You know, you probably also have bupropion here on the market, where bupropion, noradrenergic, dopaminergic, had a bit of the same, but agomelatine is more easy to handle. With bupropion, most of you using it, you know that in the beginning you can have quite a lot of agitation, a little bit of anxiety, irritability, agitation, and you will have that much less with agomelatine. Cognitive functioning, I'm going to be much shorter. This was, of course, the main part of the presentation. Just short going to cognitive functioning and anxiety. Maybe we should go beyond the standard scales. And if you take, this is a very interesting study. I'm going to just mention it briefly. This is a study where they put together the MADRS, the Hamilton, and the Beck. The Beck is self-rating. This is physician rating, physician rating. And they did a cluster analysis to see which of the symptoms are clustering together. And they found a solution, highly statistically significant, with all these sub-factors. And one of them was interest and activity. Items like interest, enjoyment, concentration, decisions, ability to feel, activity, energy, and sex. You could also call this one, because that's the name they give based on something of these items, you could also call it positive affect and cognitive functioning. Concentrations, decision-making, activity. So that's a factor. Why was that important? Because this factor was just the one that was most predictive of a good outcome. So most probably, cognitive symptoms and positive affect, what they call interest activity, is probably, which is very important to get a good outcome with your patients. So just one other example of saying that it improves also the cognitive functioning. That's what, of course, you expect if it's influencing the noradrenergic and the dopaminergic system. Well, here, emotional reactivity improves, cognitive speed improves, psychomotor function dramatically improves, motivation dramatically improves, and the sensory perception improves. So you see, this is a naturalistic study. There's no controls. You see that by treating with agomelatine, you have different cognitive functions that all are improving. And the last one is anxiety, putting the light on anxiety. And this is just looking at the anxiolytic activity of agomelatine versus SSRIs and SNRIs. And you see here, it's one study head-to-head, agomelatine versus venlafaxine versus fluoxetine versus sertraline. And you see that there is even a trend to even statistically significant superiority in reducing anxiety with agomelatine than with those SSRIs and that SNRI. My last 5 to 10 minutes are on functioning. I said, talked a lot about positive affect, a bit about negative affect. What is now the influence on function? Remission. If you talk about remission, I said at the beginning, I showed you response rates, but we all know you want to have your patient in remission. It is symptom-free. It's very strange. Remission, that's a term we borrowed from oncology. The first medical specialty that used the term remission was oncology. There's another word to use a lot in psychiatry. You can guess it, which one, which comes also from oncology. And it is quality of life. That's also a notion that started in the field of oncology. Now it's everywhere, but it started in oncology. So we talk about remission, but remission in oncology is a complete absence of illness activity, neoplastic cells, in addition to relief from the signs and symptoms of malignancy. The question is, if with our depressed patients, if we ever get there? In fact, no. Because you know, if you have patients who had suffered from depression and you do mood induction experiments, immediately the dysfunctional attitudes, they bump up again. So they are dormant. So probably we'll never get really back to baseline. The daily functioning, because remission is only defined in the literature by symptomatic remission, never about functional remission. Why is that? Is that because functioning is too much affected by other characteristics, personality, context, difficult to change? If you have problems at work and you're depressed, maybe you're out of your depression, but is your occupational function therefore better? Maybe a bit, but not totally, because the context of your work is there. Or is there a time lag that has been suggested quite a lot of times in the literature that first the symptoms improve and it takes longer before the functioning improves? studies contradicting that also. Or is it that the pre-morbid functioning is the strongest predictor of your post-treatment functioning? Or could it be that if you want to improve functioning, that maybe more psychotherapeutical approaches are needed and not only pharmacological approaches? This is just very recent. That was in Berlin at ECMP by Pierre-Michel Lorca from France. When they look, this is just looking at the correlation between positive affect and functioning. And you see a correlation coefficient of 0.64, which means that about 38, 39% is going together. So positive affect changes, increase in positive affect is very much linked to improved function. And again, I showed you already that it was for different symptoms, that it was for the different emotions, that it was for the cognitive functioning. And it's also true for the real functioning occupational, social life and family with the Sheer Disability Scale, a naturalistic study. You see a dramatic decrease in impairment in functioning. And even if you look in a more health economic way, you see that the number of days lost for work or the number of underprotective days, you see a dramatic improvement by treating it. And I come to my conclusions, Mr. Chairman. I try to show you that there is no publication or reporting bias with agomelatine, and that's good news. It's the newest antidepressant, and these bad habits from the past have gone, apparently. I try to show you that anhedonia, lack of positive affect, is a core symptom of depression, but not sufficiently taken into account. That agomelatine reduces negative affect and increases positive affect, and that is probably something which is very specific for that particular drug. That functional impairment is not sufficiently taken into account, although it's very much linked to the changes in positive affect. And I showed you some ecologically valid studies, the more naturalistic studies, illustrating the efficacy of agomelatine on symptomatic outcome, but as well also on the functional outcome measures. I thank you very much for